long time she waiting to make this baby for a man to give me a break. She said, Squeezy, darling, you give me party. So tell me whenever you're ready. This is the only opportunity. She want me stick the cake and she party. Oh, she tell me stick the cake when I'm ready. She want me push me knife in the center. Then we go pose and take out a picture. She said, stick it up right now. Stick it up anyhow. Stick it up right now. Stick it up anyhow. She want me stick the cake and she party. Oh, she tell me stick the cake when I'm ready. She want me push me knife in the center. Then we go pose and take out a picture. She said, stick it up right now. Stick it up anyhow. Stick it up right now.
I'm feeling, 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 I'm feeling.
Welcome, welcome everyone. Welcome ambassadors, Ambassador Coley, Ambassador Thelma Philip Brown, Councillor General Mayor, Ambassador Lynch, Ambassador Smith. Welcome, welcome. COVID-19 guys, welcome. Caribbean Update. Happy that you joined us. And all our guests, distinguished guests and visitors who have joined us. Hi, Miss King.
Hi. Hi, how are you?
Good, good.
Hi. You stop making noise.
Stop making noise.
How was your day today?
It was good.
That's
Not
good.
bad, not bad.
Okay. Still waiting for the others to come on?
Yeah, it's 5 o'clock now, so people are coming in. Want to welcome everyone to Caribbean COVID-19 event. We're so happy that you have joined us. Thank you for being on board. And to hear the update on what's happening in the region for Caribbean COVID-19. We're going to go Facebook Live shortly. Hello, Angela. Happy to see you. Good evening, everyone. I want to welcome you to Caribbean COVID-19 updates on what's happening in the Caribbean, and also to find out how the vaccine is going along in the region. We're so happy that you have joined us. Distinguished guests, all protocol acknowledged, ambassadors, all our representative, friends of the Caribbean American, who have joined us for this COVID-19 update, another series to town hall meeting to give you an update on what's happening in the region from various islands who are participating with us here on the town hall meeting Zoom. Some of our participants are islands that are participating are Bahamas, Barbados, Curacao, Grenada, Jamaica, St. Kitts and Nevis, St. Lucia, St. Vincent, and the Grenadines. And I want to acknowledge all the ambassadors from each Caribbean islands who have joined us to give us an update and, just to hear from them what's happening home in the Caribbean. We all are here in the diaspora. We're so happy to gather information, extend engagement, and see how we can help as Caribbean diaspora for the region during this terrible pandemic. But there's hope. There's hope. We see the vaccine is here, and as people get vaccinated, hopefully things will come back to normal, but not as it was previously. So want to welcome everyone. It's that time. We're so happy to have you join us. And we're going to start off with an opening on Authentic Caribbean update for 2021. We want to say, I'm Andrew Sharp. I'm the chairman of the Authentic Caribbean Foundation. And we're so happy that you have joined us as we continue to do the work right here in Massachusetts, providing support for our disability communities and also providing support for Caribbean American community right here in Massachusetts, and also extend our outreach to the Caribbean region where we can provide such support for the region. We're looking forward to June, National Caribbean American Heritage Month coming up. And as usual, I know Dr. Nelson is on the call, but we're the stalwarts of the state to do different things this year. This year, we're bringing in the Caribbean University students in which we're going to erect exhibition throughout various cities of Caribbean American communities, highlighting how the month began, when our people arrived, and the future of Caribbean American in the 21st century up to 2030. So Authentic Caribbean is pleased. We continue to provide support to our disability community. We were so happy to provide support to St. Lucia with a disability wheelchair we handed over. And we have many other medical equipments and others services that we will be providing right across the region. So our goal is to assist the majority, at least 90% of the Caribbean. And we're so pleased that we're working on a disability training program for the Caribbean region that will be rolling out this year for majority of the Caribbean islands. So again, the work continues. We encourage everyone. I want to acknowledge all my Caribbean American organizations who have joined us on this call. You also is doing a great job in the community, and I want to extend my gratitude and just to uplift you as we continue to build a strong Caribbean. It's with great pleasure that we commence this town hall meeting, and we're happy to provide some information. Dr. Nelson, is there any word that you'd like to say to us before we proceed into the...
Yes, I'm just thanking everybody for joining us. We're going to have a rapid round robin today. Andrew and I are promising to keep this meeting really tight. And again, tomorrow is World Health Day, so it's very important that although we're focused on the vaccination process, we know many Caribbean organizations have been engaged in healthcare diplomacy of their own. And so we wanted to make sure we use this opportunity to remind people that we do have a healthcare working group that we've been working on since 2017, and we have room for more players. And we want to make sure that we use this challenge of COVID to not just focus on response to COVID, but to look at healthcare for all. And so we're looking for people from all aspects of healthcare to join our healthcare working group. So with that, I turn the floor back over to Andrew and look forward to a wrap up where I'll be able to say, a little bit more about where do we go from here as we plan out for June, what we'll be doing in the healthcare sector. Thank you.
Thanks a lot, Dr. Nelson. So it's now time for us to get an update on COVID-19 in the region and also the vaccine. It's with great pleasure that I bring to you the island of the Bahamas, Ambassador Sidney Coley and Delon Brennan, MD, Deputy Chief Medical Officer in the Ministry of Health. Welcome, Ambassador. We're so happy to have you with us on the COVID-19.
Thank you very much, Andrew and Dr. Claire, and all of the members of the team of Authentic Caribbean for staying true to the cause and putting on another one of these events, this time an update on the COVID-19. I want to say greetings and salutations to all my colleague ambassadors, to all the different organizations around the Caribbean, and to all of the members of the Caribbean diaspora who are on the call. This is an excellent way of keeping the Caribbean region in touch with each other and to learn about what is going on in the islands and to see how the different, even though the islands are scattered, how we all doing things and generally the same way. It is really my great pleasure, Andrew, this evening, not to be giving the update, because I brought with me a very distinguished medical doctor from the Bahamas, Dr. Delano Brennan, MD. He's the Deputy Chief Medical Officer in the Ministry of Health in Nassau, and one of the leaders and the COVID program. Without further ado, I would call on Dr. Brennan, who will give us a brief update on the COVID-19 protocols and the introduction of the vaccines. Dr. Brennan, please.
Good afternoon, good evening, all. Thank you for the opportunity. I know our time is short, so I'm going to share my screen and jump right into our, well, it says host disabled participant screen sharing. So if the host wouldn't mind, I'll be able to share my screen. Again, it's just a pleasure to be able to share with you today Sure, thanks. What's going on in the Bahamas. So we'll start here, and hopefully, I know there's a 6-minute time frame, so hopefully this won't be too rapid fire. Our first case in the Bahamas was actually identified on March 15th of 2020. So we just hit the 1-year anniversary of the discovery of that first case. To date, as of yesterday, we had 9,270 total cases in the Bahamas. And what you can see is we had this happen in just about 2 waves. Our first wave occurred between March and June of 2020, and then we had 104 cases. And the second wave started August of 2020 and goes on to what some might refer to the present, because we've never really gone back to 0 cases during that time period, but mostly August through December, and we tailed off fairly significantly thereafter. Some of the control strategies that we did have to put in place, again, without going into too much detail on each of them, one of the things that we put in place very early was just sort of a communication and education campaign. And as a part of that, we wanted to let the Bahamian people know what was going on with COVID-19, even though it hadn't arrived at our shores yet. But given the transmissibility that was going on and what we were seeing in some of the other countries and other regions of the world, we wanted to let them know that it wasn't a matter of if it would come to us, but when it might come to us, and having to be prepared to take care of that. So as we did, and as our cases, our first case rolled out, we started to put into place things such as border control policies and travel restrictions, which, if you remember at the very beginning of all of this, was very controversial. Because it was said, given the, all of our signing on with the international health regulations, with the World Health Organization and other treaties and the like, that restrictions on travel and trade really should be a last resort. But given what was going on and the growth of this, we put them in place fairly early. And, whether it really stemmed the tide or not, that's really a conversation for a different day. But they were put in place to help us to better be able to prepare and contain, because having, the size and the spread, we're not just one single landmass. We have islands, multiple inhabited islands within our region. We needed to make sure that we could at least stem the tide of it coming into country, so that we didn't get a flood of it and overrun our medical facilities. We installed testing capacity in collaboration with the Pan American Health Organization in late February, early March. So we were prepared early to be able to pick up cases, and we put together a laboratory network of public and private labs in order to assist us to be able to really track what was going on with the outbreak in country as well. We put in place workplace policies, trying to maximize as much on social distancing and work from home policies and the like. And that was implemented even in the public sector, which had long not been a part of the move toward a work from home, but it got implemented even in our public sector as well. And it was seen where we could take advantage of some of the capacities put in place by technology to be able to do that. There were then quarantine and isolation policies from the highest levels of Parliament that were put in place, and being enforced on the ground. We were able to actually put together a COVID-19 enforcement unit that was staffed by the Royal Bahamas Police Force, and they also trained some non-police officers to be COVID ambassadors in that grouping. But they're uniformed and the like, and they're still obviously active to this day to make sure that all of our policies when it comes to social distancing, mask wearing, and the like are actually adhered to in country. We put together public-private partnerships that had never been seen before, the likes of which had never been seen before in country when it came to taking care of inpatient capacity for patients who needed that level of care for COVID-19. And so we were able to use our private hospital network to be able to care for these patients without necessarily having any charge for that care directly to the patient. And all patients, were seen as COVID-19 patients and not public versus private. We not just on a healthcare landscape, but we actually put together a pretty robust stakeholder network that was engaged from the public sector and the private sector for other parts of this as well. And I think one of the things that we had not seen before that we are fairly proud of is our ability to communicate with the public and give them an information on a daily basis. So we have a daily COVID-19 report that comes out, no matter when it is, weekends, holidays, and the like. That's been coming out. Like we said, March 15th was our first case, but we had this report coming out even before that. So on a daily basis for more than a year, we've been giving the public an update as to what's going on with our COVID-19 situation. So we thought that was a great accomplishment for the team. A lot of what we needed to do as we realized, as most people realize, in order to get real control of this, we needed to put together a vaccination strategy. So as far back as November of 2020, we actually penned and put together and were able to share with stakeholders a COVID-19 vaccination strategic plan. So that was able to be shared with stakeholders in country, and we were able to get their input. And it's a dynamic process, obviously. So you go from strategy to then implementation plan. And then as we continue to roll out, even on a, if not weekly basis, sometimes even on a daily basis, there are modifications made to how it's being rolled out so that we can get it most effectively delivered to those who need to get it at the time. Parts of those plans include, targeting and surveillance, demand generation and communication, monitoring and evaluation, service delivery, training and supervision, some of the regulatory things that needed to be in place, how we're going to finance that. So all of this needed to be covered as we went through. And we couldn't do it on our own, just assuming we knew it all. So we had to go to the public and find out what their thoughts were. So this is just one example. We went out and found out from healthcare workers what their thoughts were around the COVID-19 vaccine in particular, and found out for healthcare workers, since they're on the front line and those are the ones who are most likely to be affected. But, from all areas of public health, the advice is always to make sure that your healthcare workers are taken care of first, so they'll be around to take care of other patients. So we needed to find out specifically from our healthcare workers what their thoughts were. And that allowed us to then generate communication specifically to them and for them to give them the information they needed to make an informed decision about whether they wanted to get the vaccine or not. Because, across the board, whether healthcare worker or otherwise, it is still a voluntary program. So no one is being forced to take the vaccine, but we want people to at least have enough information to make an informed decision. Another one of the advances we think, is to be lauded, just given the short timing things were being put in place, is actually an electronic immunization registry. Unfortunately, we have to admit that, a lot of what was happening before was a very manual process when it came to recording of immunizations in country. And so now we have moved toward having an actual electronic immunization registry so that no matter where someone is in the country, their immunizations can be all recorded in one system that would allow us to know who has received vaccine, what vaccine they received, and if there's an adverse event, that we would be able to jump on top of it as quickly as possible. So the electronic immunization registry is really sort of a big part of the backbone behind our vaccination program. And it is really being rolled out for COVID, but obviously it will be in place for our other vaccines as we move forward as well. And so some of the back data for persons who've been vaccinated with other vaccines is actually being put in right now as well. So it'll make it even more robust as we move forward. The logistics and cold chain, we obviously needed to know how we might be able to deliver all of the cold chain capacity that goes along with vaccination. So a lot of that was put in place. And undergirded in all of this is we had to have regulatory pathways that allowed us to do so. So how could you decide, especially in these emergency use situations, what vaccines you'd be able to receive, under what conditions, and then be able to deliver with confidence the information to the public so that they would believe that the type of regulatory approval that has been put in is robust enough to protect them. So we've been working in addition to, these parts. One part of what we've been doing is working with the COVAX facility, as so many others within the region, but across the world are doing as well. And so the Bahamas, we were able to put a down payment on for 20% of the population, so about 80,000 people, to receive doses through the COVAX facility. So to date, we've been working not just with COVAX, but also directly with manufacturers and bilateral agreements with other countries. And, through those different mechanisms, we've been able to receive about 54,000 doses in country. Some as recently as last week, received about 33,000 doses. So, this is an ongoing process, but, a country of about 400,000 people, while 54,000 doses sounds like a lot, we still have a lot of work to do to be able to get more of our population vaccinated and receive doses enough to be able to vaccinate them all as well. So our current distribution plan, as of March 20th, we actually launched the pilot. Having received vaccines in country the week prior to that, we were able to do all of the regulatory checks, and we were able to do a pilot as of March 20th. And March 23rd, we started the wider rollout for it. And you can see the populations we targeted: healthcare workers in the public sector and those in private sector assisting with the rollout, elder care homes, residents and staff, uniform services. We've gone to, including others as well. So this was just how it started, but we're rolling to, other vulnerable populations, those who have chronic non-communicable diseases and the like. That's how, we are continuing to add others to the grouping now that we have more vaccines in country. Moving forward, the expectation is that just a couple of things I wanted to include here. We're looking toward moving toward genetic sequencing for variants. So, making sure that we know exactly what's going on in country, not just with the wild type that was originally in place, but the other variants as well, and having the testing capacity to be able to do that. Making sure with our communications, we think, we're doing fairly well now, but we're fighting this issue around COVID fatigue and misinformation. So we need to make sure that we stay on top of our game with that and don't lose that momentum. But we also want to make sure we continue to encourage vaccine acceptance now that we have it in country, and get as many people on board and informed as we can, to get to a point where we feel as though we can continue to safely open up and receive persons from the outside, but also persons beginning to intermingle more without necessarily as much of a fear of spread in those, especially social type of situations. We do need to make sure that vaccine procurement is secured across the board. So equitable distribution to countries. So we know there's been an issue that, even CARICOM has brought up about especially smaller economies and small island developing states such as ours, not necessarily getting access to vaccine as quickly as possible. So we all need to continue to advocate as much as possible for us, along with other, small economies, to be able to receive vaccine. And it doesn't just become an issue of, those who have the money or have lots of money being able to protect their population, and others not necessarily being able to do so as well. But when we do receive it in country, we want to make sure that we don't have issues of inequitable distribution. We want to make sure that, we use the principle of justice, where those who are at greatest need are the ones who receive it first, and then, we keep it moving from there. So that kind of covers, hopefully, a good snapshot as to what's going on in the Bahamas. And, hopefully we'll be able to add anything else, but looking forward to hearing more from our other colleagues. Thank you very much, Ambassador Cawley, and our chairs of this meeting.
Thank you so much.
Thank you, Dr. Brennan. There is a very comprehensive presentation by one of the leaders in the country of the Bahamas regime. Thank you, Andrew, and back to you.
Thank you so much, Ambassador, and I want to thank Delon Bernin from the Ministry of Health, the Deputy Chief Medical Officer, And that was great information for the diaspora, especially for the Bahamians who are living here and many other diaspora members on update on COVID and also about the vaccine. So thank you very much. We're going to switch island and we're doing it in alphabetical order. And it's with great pleasure that I introduce Ambassador Noel Lynch from Barbados. We're so happy to have Barbados giving us an update on COVID-19. So Ambassador Lynch, the floor is.
Good afternoon, Andrew. I hope you can hear me and see me.
Absolutely.
Hope you can hear me and see me. Thank you very much. And I just want to thank you and Authentic Caribbean and Dr. Nelson, as usual, for thinking about us and thinking about the Caribbean and continuing the stellar work that you're doing in the region. I'm going to attempt to share my screen. If it doesn't share, I do hope that we can, do hope that if I can share my screen. And can you see anything? Can you see?
Yes, Ambassador.
Okay. You can see my screen.
Yes.
Okay, well, perfect. Thank you very much. Well, just let me say, obviously I'm not a medical doctor like the last presenter from the Bahamas, but I'm just gonna try to update you as much as I can on the issues for Barbados. From the time we first had our first case back in March of 2020 up to now and all that Barbados has done. When we had that first case, our government moved swiftly to employ the resources necessary to be able to protect our people. And one of the things that Barbados did was that it was impossible for us to be able to treat these people within the same facility at the Queen Elizabeth Hospital or major hospital. So the government moved quickly, and within just 3 months, we had a new facility erected in the north of the country, which was an isolation facility. In addition to that, we were utilizing an existing school that we converted into another isolation facility. In other words, if you're detected with that you have symptoms and that we're sure that you have been infected with the virus, that you were sent to this facility and then to the one in the north if you had to be isolated. Barbados also moved very quickly to be able to protect our frontline workers, the uniformed services, and of course the elderly in Barbados. And we tried our best to keep infections down. We never closed our borders in Barbados. But obviously, being a tourism destination, a lot of the flights that we had coming into Barbados, the numbers were reduced. And we didn't have as much capacity, seat capacity as we would have normally into Barbados. But even then, our tourism industry kept on going until into December of last year, December 2020, when there was a spike in the country. What happened is that a number of tourists came in from one marketplace, that is our major marketplace. And then what happened after that, there was a spike. So Barbados had to not close down its borders, but what we did was we stopped the movement of people in the country. There were numerous lockdowns. There was a lockdown for as long as 14 days to keep people with curfews, that you couldn't leave your house between 9 and 7 at first, and 5 in the morning, and that moved 6 in the morning, and then that moved from 7 until 9. So people were able to go about their daily duties, but obviously under the same protocols that you're talking about: social distancing, keeping people apart as much as possible, the wearing of masks, all these things went along. And Barbados was able to bring it under control. Now, a more recent time, in the last, after the end of January, we instituted again another lockdown to be able to prohibit and restrict the movement of people internally. And what has happened is, if you come into Barbados now, you're subject to 5 days quarantine. You have to come with a PCR test, which must be taken 72 hours before you arrive. You're then subjected to 5 days of quarantine, and then you take a second test, and if that test is negative, well, then you're allowed to circulate with the population. Even then, obviously, there were cases. And if you look at the screen, you will see where Barbados is today. This information was information that was received yesterday. This information was received yesterday in Barbados. And if you look at it, the totals for the period of, let's see, this is the screen here, yeah. Okay, totals for the period of April the 4th, 2021. Today is the 6th of April the 4th, sorry, not the 5th. The test results that we had, 354 tests. The number of people in isolation were 109. There were no deaths. We've had 6 new cases, all female, and the number of people that were discharged were 3. In terms of the cumulative totals, we've carried out in Barbados 143,326 tests. The total cases that we've had to date is 3,685. And you see the distribution there between male and female. Total number of deaths in Barbados, 43. And the total number of people recovered, 3,537. In terms of vaccinations, we were one of the first countries in the region to receive vaccinations from the government of India. We received 100,000 doses, which we actually shared with a number of other countries in the region. We were able to distribute to them. The total number of people that we vaccinated thus far is 63,738 people. Barbados has a population of 285,000 folks, so we're not anywhere near the level of herd immunity that we're talking about. As a matter of fact, the amount of people that were vaccinated in Barbados is 22% of those that are eligible to receive the vaccine. Remember, children under 18 or youth under 18 are not eligible at this point to receive the vaccine. So you're talking about a third, if you talk about the distribution of your populations. And we need to vaccinate about 126,000 people to be able to reach the herd immunity that we want at 70%. But you can see the number of people that were vaccinated, 63,738. The distribution between male and female, 26,344. And the female population, females, 37,394. Today, only today again, Barbados received an additional 33,600 AstraZeneca vaccine provided by the COVAX facility. Now, just let me say that Barbados and most of the countries in the region, we're not using Pfizer or Moderna or Johnson & Johnson. We're using the AstraZeneca vaccine, the Oxford AstraZeneca. This arrived in Barbados only early this morning. We received 33,600 more doses that arrived on the Caribbean Airlines cargo flight. The Prime Minister herself was there at the airport to receive these vaccines. We hope that obviously that's going to take us closer to the point where we need to get to herd immunity, but there's still a lot of work left to be done. We're far from out of the woods. And just let me say finally too that that in these Caribbean destinations, these Caribbean countries that are dependent on tourism, we never started any pandemic. Countries of the Caribbean did not create this pandemic, and they have been the most successful in containing it at great cost to our treasuries. We have been the little fiscal space that we have had, are faced with some of the issues that we were dealing with, climate change, and then to be hit with this particular pandemic. The countries that are the most indebted countries in the world, you can understand what we're going through. We're fighting with the international financial institutions to give us that fiscal space so that we can continue our march towards development. But just let me say this finally: if the world, developed countries, vaccinate all of their people, and you do not allow vaccines to be sent out to the rest of the world, you still remain in grave danger. And that is the message that should go out and should go forth from any of these small countries, that you can't ring fence yourself away from the rest of the world. We want people to come back in, so we've got to ensure that, yes, they're vaccinated and when they come in, but also the ones that are in our countries have got to be vaccinated. And that's where the dilemma is. We're trying our best every day, but you can see the results there. You can even see the world stats as of April the 4th at the bottom of the screen. So Andrew, thank you very, very much. Thank you very much, Dr. Nelson, for this opportunity, and any questions you can ask at the end when everyone is presented. Thanks again.
Thank you so much, Ambassador Lynch from Barbados. From Barbados, Ambassador Lynch, we appreciate the update and information you have given us on Barbados COVID-19 and the vaccine. We're so happy that you guys now have started to receive the vaccine, and hopefully we'll be distributing more as things go along. Our next Caribbean country with us, and we're so happy to have them presenting from the island of Curacao. We're so happy to have the island of Curacao who have joined us, and Darylyn Van der Veen will join us and do her presentation. We're so happy to have her. She's from the ministry. Welcome, Ms. Darylyn.
Hi, welcome everybody. Thank you for having me. I'll try to share my screen. Hopefully you all can see it right now. As Andrew said, my name is Darylyn Van der Veen. I'm from the Directorate of Foreign Relations in Curacao. Like all of us in the Caribbean, we've all had to deal with this pandemic. Curacao had its first COVID case on March 13, 2020. It was a Dutch gentleman coming from the Netherlands. And he was also our first death a couple of weeks later. Curacao entered into total lockdown on March 27th, 2020. We eased up the lockdown mid-May and allowed again for tourism in June 2020. Right now, we only make a distinction between low and high-risk countries. Low-risk countries are a number of Caribbean islands. The rest of the world is high risk to us. We do ask for a negative PCR test and a health locator form and the ID, the immigration card to be filled online. Our COVID numbers have been relatively low, with a total of 4,730 cases and 20 deaths in a year's time, so to speak. So the first and second wave, we've done relatively well to keep the numbers low compared to our sister island of Aruba, for example. However, since March 1st, we entered the third wave of the pandemic, and that third wave has hit us very hard. Right now, our situation is very critical. Cases are on the rise, so much that we have the highest infection rate in the world. You want to be #1 in the world, but for other things, not for a pandemic number. In just 1 month's time, and the numbers as of yesterday show we have 4,489 cases. We've gone from 22 deaths at the end of February to 52 deaths as of yesterday. Just this past weekend, 14 people have died. We have 126 persons in the hospitals, of which 37 in the ICU. We started sending patients to the hospital in Aruba as our ICU is well over capacity. We have scaled down our medical care. Only emergency cases are being dealt. We're even using the building of the former hospital. So we have more capacity, more beds to put people. The hospital has made a dramatic appeal on the population for retired doctors and retired nurses to come and help out, and other volunteers. We've asked the Netherlands for assistance. This past weekend, some 20 doctors and nurses in total have arrived to assist us. As you can see, here was a number of the third wave. We believe the third wave is a consequence of two issues. Mid-March, we had parliamentary elections on the island. Moving to the elections, we had different gatherings from people for the different parties. Election night, the parties who won the election, of course, celebrated. You could see images of people not wearing masks. And after a year being in this pandemic, we all can understand we're all tired of all the various measures that the government has been taken. But it hasn't helped the cause. So as you saw, the numbers are pretty high and they're still climbing. We started our vaccination in February, and end of February. The strategy at first was the frontline workers, the healthcare workers, and the people above 60 and above. By mid-March, we added people with certain chronic diseases. However, due to the drastic rise in cases, as of yesterday, all adults above 18 can register and be vaccinated if they want to. As of yesterday, we vaccinated 22,031 people, about 13% of our population. We have about 160 in total. Of these 22,000, around 8,100 or 8,200 have received their second shot. Compared to other countries, we get our vaccines donated by the Netherlands. And so far, Pfizer vaccine has been administered to the people on the island. Curacao is presently in its second lockdown. Everything is closed, but for vital and essential stores as pharmacies, supermarkets, gas stations, restaurants are allowed to do delivery, but no curbside pickup is allowed. Government is closed, only essential people can go to the office. Everybody is stimulated to work from their homes. We have a curfew in place from 7 p.m. until 4:30 in the morning. Because of all this, since this started last year, March, we've seen a 20% economic decline, especially the tourism sector and hospitality sector have been hit very hard. We have an indebtedness of 100% of our gross domestic product. The way to move forward, we're looking at diversification and enhancing regional collaboration. We're working toward the accession procedure of becoming an associate member of the WTO and also of CARICOM. We have to work together within the Caribbean. We're looking at further trade possibilities and looking to other initiatives in the field of circular economy, renewable and sustainable energy, just to compensate the hit for the tourism sector. And of course, we like to say we're outside of the hurricane belt, so we would like to capitalize on that using Curacao as a hub. Thank you very much. If you have any questions, look forward to answering them.
Thank you so much, Darlene van der Veen, Director from Curacao, the island of Curacao. We're so happy to hear the update, and we're so happy to have you on our COVID-19 series to give the Caribbean diaspora an update on what's happening in Curacao. Thank you, Ducci. Thank you. Now, we're moving islands to the wonderful spice of the Caribbean. And we are excited to introduce Ambassador Yolanda Smith from the Spice Island of the Caribbean, Grenada. Thank you. Hi, Ambassador. Welcome.
Hi, thank you very much. I really like that introduction. It gives me a chance to really spice up this thing here. And I'm spicing it up because I don't have a presentation to share. So it's the colors you're looking at right now. Right, Ambassador Lynch? I want to say good afternoon to my Caribbean colleagues from the CARICOM Caucus, Dr. Nelson, Andrew, and Authentic Caribbean Foundation. Thank you so much for giving us the opportunity to share again. We've done so twice since the pandemic, and this forum is a wonderful forum in which we can engage our diaspora, not just the Grenadian diaspora, the Caribbean diaspora on a whole. And for the countries of the Caribbean region, building resilience in the wake of the COVID pandemic is particularly challenging for us. Our fragile economies, while trying to recover from the ravaging effects of climate events, along with the usual economic, social challenges, we're now facing serious threats of the survival of some of our key industries. And for us in particular, that is tourism, which is the lifeblood of many of our countries in the region and our people. But a key opportunity and certainly a defining moment for Grenada is that we are going to be having our national population and housing census this year. And we feel that the COVID-19 pandemic has provided additional rationale for the census because it can yield the evidence to enable positive development outcomes and to build a more resilient country. So the reality is that we can no longer say the pandemic is a sudden short-term shock. It will be with us and it will be integrated into our lives over the long term. So what we're doing is reshaping our thinking and becoming more creative in our approaches to the collection, production, and dissemination of data. We know government has a responsibility to ensure that all the citizens are served and that no one is left behind. And speaking of data or COVID dashboard, and I must confess, I don't have the latest, the very latest, but what I do have is on numbers as of April 3rd. And if you remember in the last presentation we made, Grenada had recorded our first case on March 22, and we'd shut down the island on March 23rd. So if I should go with the local figures, confirmed cases, we've had 156. Of that 156, the total of 154 have recovered. We have 1 active case and 1 death. We have no local cases right now. The 1 case we have is an imported case, and of the 156, 78 of those were imported cases. The total PCR tests we've conducted so far is 25,047. The total number of people in quarantine facilities at this time is 449. Throughout the entire pandemic, we had 6 cases that were hospitalized. And as we go into the phase of vaccination and inoculating a population, we have, for the first dose, we've had 10,371 persons have had their first dose, and 2 people have had their second dose. So of course, we're a small population and we're just getting to the second dose stage. Of course, I don't even want to shock you with the global numbers because as of that date, we had confirmed cases was upward of 129.9 million. And the people who are vaccinated worldwide based on, of course, that's April 3rd again, is 547,727,346. So we know that we have a long way to go when it comes to vaccination. And for us in Grenada, as relates to the accessibility of vaccine and getting a population inoculated so we can have the herd immunity that everybody is talking about, which based on science is between 60 and 70% of your population. That is a challenge for us. And as some of the other islands have said before, getting the vaccine to our countries, one thing, and then getting the population vaccinated is another. So we're grateful to the government of India and through our CARICOM neighbors who have given us out of their share, also the governments of China and Russia. Right now on the island, we have 23,000 doses on hand. We're part of the COVAX facilities as most of CARICOM, but we are waiting to get our share of that right now. But we remain grateful to the government of Cuba, who continue to provide medical assistance to Grenada in the form of doctors and nurses, equipment, and technical assistance. Our Ministry of Health, and in fact, the government of Grenada, has mounted a public communications vaccination campaign. And the idea is to encourage vaccine acceptance and to remind nationals that getting vaccinated adds another layer of protection for us, for our co-workers or families or loved ones. And as I said, Grenada have 23,000 doses, and that's of the AstraZeneca vaccine, which we feel to be safe because it's approved by the World Health Organization. And right now, every national in Grenada who wants to be vaccinated can be vaccinated, and it is free of cost. To the Grenadian diaspora listening to me now, I won't try to convince you to take the vaccine, but what I would advise you is that if you have reservations, that you should check with a healthcare professional, take advice from the experts and not necessarily your friends and family. If you have made up your mind to take the vaccine, I will not tell you which vaccine to take. All I would say to you is that the best vaccine is the one that is available to you. I share the sentiments of the Ministry of Health in Grenada. We have the slogan that if you get vaxxed, it is the best shot we have. So that is what I would advise anybody right now. The best vaccine is the one that you can get into your arm right now. And as it relates to travel and the status quo, persons wishing to travel to Grenada, whether you're visitors or nationals, you can access the Grenada travel portal at covid19.gov.gd. That's covid19.gov.gd. You can apply for your pure safe travel certification there. You can pay for your COVID test. You can make arrangements for quarantine. The portal is a one-stop shop. The latest protocols and the travel advisory is housed at that portal as well. So some of the questions, or one of the most frequent one we get right now at the embassy is that am I still required to quarantine upon arrival in Grenada if I'm fully immunized? And for right now, the answer is yes, you are still required to quarantine because getting the vaccination doesn't prevent you from transmitting the virus. And until we get enough of our citizens inoculated, we have to protect them and we have to protect you. So right now it is still yes, even if you've had your 2 doses, if you're on the 2 dose, or if you had the Johnson & Johnson and you got your 1 dose, you're still required to quarantine in Grenada. We are open for visitors and nationals alike. And as it relates to some of the challenges we're having, I think they're based on technology and PPE for schools that remain 2 of the basic needs we have. We've been getting donations from some of our partners through bilateral and other arrangements. But I want to publicly thank the Grenadian diaspora who contributed to a fundraiser we had during our independence celebrations in February. And it was just a 1-month promotion. And we partnered with Scott's Medical Supply, and we were able to procure 10 of the touchless sanitizing stations and 10 of the touchless thermometers, which will be installed in the primary schools in Grenada. I want to say that every little bit counts, and we thank you very much. And that's the end of my presentation. I'll be happy to take questions later on. Thank you again, Andrew.
Thank you so much, Ambassador Smith. We're so happy to get an update from Grenada. And hopefully things will change so I don't have to quarantine so long in the islands. We're missing home, we're missing Caribbean.
Definitely.
Next on our island hopping is the Heartbeat, Jamaica. We're so happy to introduce Consul General Oliver Mayer, who will give us an update on COVID-19 in Jamaica. We're so happy to have Consul General Mayer, who will give us an update from Jamaica, the Heartbeat. We're so happy to have you, Consul General.
Thank you very much. Thank you very much. And let me just acknowledge your work that you're doing here to bring the attention and focus that is required on such an important issue. And I think communication is so important for us. And us moving together as one unit. Unity is strength. And you know, here in Florida, I should note that the Caribbean Consular Corps, we have been meeting together on a weekly basis. And in addition to necessary advocacy that has been coming, especially from Washington. We have been supporting from this end through, immediately to the Secretary of State and then to the governor. We have been trying from all different angles to advocate for more vaccines, not just for Jamaica, but for the region, because it's so important that we get vaccinated as soon as possible. I have a verbal update. Since the last time we met, unfortunately, things have, as we say, have moved south for Jamaica. It's been a very challenging time. And we have had the Prime Minister has instituted a number of measures in terms of closing down, lockdown on weekends, especially over 3 weekends. We have one more weekend to go of lockdown, especially during the Easter period here, where a lot of Jamaicans would gather for church, etc. All of those have been locked down. So in the week, we have reinstituted the curfew periods starting from 8 p.m. To 5 a.m. in the morning, but on weekends, persons have to stay home. The cases, currently, Jamaica now has 41,000 cases. So the numbers have jumped significantly. And one of the challenges that we have had is that the positivity rate has hovered between 32 to 38%. So it's a very serious situation happening in Jamaica. We've had 618 deaths. We have had 18,299 persons that have recovered. So our hospitals, currently we have 388 hospitalized, but our hospitals are over capacity. So we are having a challenge with, beds and supplies. I want to use this opportunity to thank members of the diaspora who have reached out to support. Even those here from our region, a number of the hospital chains have given. Members of the diaspora have been providing both medical supplies as well as tablets for children who are stuck at home and need devices. We have a one student, one device tablet initiative from the Ministry of Education, which we thank our diaspora for their continuous support. Currently, we have had 42,000 doses that have been administered, and we have an overall plan for vaccination, which the principles are, of course, for human well-being, equal respect, national equity, legitimacy, and reciprocity. And the first set of the vaccines, there is a plan over for the year, but for the first 3 months, March, April, and May, the bulk of the vaccines, of course, will be the AstraZeneca. We do have a small amount of Moderna that will come in later on in the quarter for May, but most of our vaccines will be the AstraZeneca. We do have a significant supply that is scheduled to come in for the second half of April. We had one that has come in already for the first half, and a major supply should come in at the second half of April. There is a major communication exercise just to reinforce how important it is to take the vaccine, because there is still some resistance. There's still persons who believe in there's this major conspiracy, and there are persons who are, organizing marches to say, don't take the vaccine. So the government has been on the offensive in terms of educating the public of the importance of taking a vaccine. And there have been a number of blitz and targets that have been set that have been going well so far. In terms of the persons that were earmarked for delivery first of vaccines, our healthcare workers, government officials, elderly, 60 years and over, the Jamaica Defense Force, the Jamaica Constabulary Force, the Jamaica Fire Brigade, or Passport and Immigration Agency, and persons who work in the early childhood, primary, secondary institution. So there is an entire implementation program which has been put out on our website, Ministry of Health website. And so we continue to administer that right across the island. We continue to really press home the point. I mean, given that we have had 4 million visitors to Jamaica, we estimate about 70%, are from the US. And so we have been really advocating heavily to the United States to provide for the region, especially the surplus of AstraZeneca that is currently stockpiled. We have also been making the point that in the worldwide cruise industry of 38 billion, 32% of all cruises are to Caribbean destinations. And so it is in the USA's interest to ensure that they get our regions vaccinated as fast as possible. It will help their industries, and it will also ensure that when their visitors come to the Caribbean, that they're also safe. Yes, so that is it in a quick nutshell. Not as my presentation is not as long as the other islands, but I just want to reinforce that Jamaica is going through a challenging time. We have been pressing home for most of the time. The last time I reported, our numbers were quite manageable, and we were doing quite well. But like many countries here, we have had a surge, and we are taking the appropriate measures to restrict movements. We have seen some positive impact from that. But the government's positioning has always been one of trying to balance lives with livelihood. We've seen a 74% reduction in tourism. And we give thanks for the 23% increase in remittances that came from our diaspora. We're very grateful for that. That has helped us to keep moving forward. But we're conscious of the fact that it's very important for our Jamaican nationals to be vaccinated as fast as possible, and for the region to be vaccinated. And advocacy for all of us is very important at this stage, so that we get the vaccines as quickly as possible, so we can get our respective nations back up operating in short order. So back to you, Andrew.
Thank you, Councillor General. Mayor, so happy to see you. And thanks for the update on COVID-19, seeing what's happening in Jamaica. Now we are island hopping again. This time we're going down south, almost south. We're heading over to St. Kitts and Nevis. And it's a great pleasure to introduce Ambassador Dr. Thelma Phillip Brown. Welcome.
Actually, Mr. Moderator Andrew.
Hi, you're represented.
I'm representing for Ambassador this evening.
Excellent. Welcome, Shanali Simmons. Hopefully I'm saying it right.
Distinguished Yes, Chanel, that's fine. Thank you. Distinguished panelists, members of the Authentic Caribbean Foundation, fellow Caribbean brothers and sisters, good evening. I am Chanel Simmons, First Secretary of the Embassy of St. Kitts and Nevis here in DC, and I bring you warm greetings from my ambassador, Excellency Dr. Thelma Philip Brown, and I wish to convey thanks to the Authentic Caribbean Foundation for this opportunity to engage and update our Caribbean diaspora on COVID-19. It is therefore my pleasure to present the update on her behalf. In January last year, when the world learned of the novel coronavirus, many never anticipated that it would leave the shores of Wuhan, China, or even fathom the socioeconomic havoc it would wreak on our societies or the world. Having observed the severity of this disease as it circled the globe, the government of St. Kitts and Nevis took swift action to begin preparations for its anticipated arrival, as well as to protect its citizens for as long as possible. The first case of COVID-19 arrived in late March, and 1 year later, the Federation has recorded a total of 44 cases, and currently there are no active cases. To date, we have 0 deaths. There were no major hospitalizations, and there has been no community spread. This, my friends, has been a remarkable achievement for us. We are not boastful, but thankful, because when we look at the situation around the world, our small nation of only 55,000 people could have been totally wiped out. The success story of St. Kitts and Nevis is one that from the very beginning adopted an all-of-society approach to prepare for and manage the pandemic. Thanks to the successful implementation of strict but effective protocols, including entry restrictions on persons traveling from high-risk areas, curfews, closure of our borders, and other non-pharmaceutical measures, St. Kitts and Nevis, as the smallest nation in the Western Hemisphere, has thus far weathered the COVID-19 storm relatively well. Given the unprecedented economic fallout caused by the pandemic, the government had to deploy considerable resources to cushion the resulting economic shocks and hardship and provide social safety nets for its citizens. Employees who were directly affected were able to benefit from the provision of various financial and tax incentives, ranging from moratoriums on loan repayments, mortgages, payments for electricity and water services, income assistance of up to $1,000 per month, among others. Additional resources were also expended to improving the health infrastructure and assisting farmers to boost agricultural production. With full compliance to the COVID-19 protocols, the Federation was able to successfully hold elections, virtual carnival, reopen institutions of learning, places of worship, and slowly increase economic activity with the reopening of restaurants and other entertainment venues through a phased approach. Since the reopening of our borders on October 31st, 2020, all travelers to the Federation have been required to submit a negative RT-PCR test taken within 72 hours of their expected travel, as well as quarantine at a government-approved facility for a period of 14 days. Similarly, travelers departing the Federation are required to submit a pre-departure COVID test regardless of their destination. This strict process has proven to be very successful in containing the disease, as well as protecting our citizens from exposure. Residents and visitors to the island must also be commended for the adherence to the protocols, the wearing of masks, sanitizing, temperature checks upon entry to businesses, schools, churches, etc., and of course, the social distancing. We have faithfully followed the science and it has worked for us. We are equally proud that our testing capabilities have been expanded from complete reliance on CAFA in the early stages of the disease to having testing done at one of our local laboratories, the Next Generation Lab, to now having access to a total of 4 local laboratories that can deliver accurate RT-PCR results. This has allowed us to facilitate more testing of inbound and outbound passengers. The next phase of the fight against COVID-19 is to get our citizens vaccinated. Our vaccine rollout program began in mid-February. So far, we have received 2,000 vaccines from the Commonwealth of Dominica, 20,000 doses of AstraZeneca vaccine from the government of India, and today we received some 21,600 doses through the COVAX facility. The goal is to inoculate 70% of the population, which is just over 33,000 people, to achieve herd immunity. As of Saturday, April 3rd, 2021, we have only achieved 28.88% of this target. That's 9,540 persons have received their first dose of the vaccine. The Ministry of Health has been working assiduously to encourage persons to roll up and roll out and get vaccinated. Vaccination information sessions and clinics are being held in all communities across the Federation. Similarly, the government has hosted several town hall meetings to sensitize the general public on the vaccines, as well as offer the opportunity to get vaccinated after the sessions. Likewise, other stakeholders, the business community and the churches, have been providing information sessions to their staff and the members. Additionally, a number of health centers are open on Saturdays to facilitate the vaccination exercise. Nonetheless, the reality is we too are fighting an uphill battle against misinformation about vaccines and the resulting vaccine hesitancy, which has contributed to the undesired slow pace at which we're able to get more people on board. While at present, we do not have access to the total number of vaccines required to achieve the 70% threshold, what we currently have is closer to the target. The longer we delay, the longer it will take for us to achieve herd immunity. We therefore appeal to our diaspora, especially those who have been vaccinated, to also lend their support and encourage their friends and loved ones at home to get vaccinated. Furthermore, we solicit the support of those in the diaspora who are well connected here in the US to help us, help our region advocate for more equitable access to the vaccine. This cry goes beyond the principle of fairness. COVID-19 is an existential threat to all of us, rich and poor. No nation is safe, no nation is secure until all nations are safe. And now more than ever, we must understand the urgency of working together to fight this pandemic in order to safeguard our future and that of our children. As we look towards the future, St. Kitts and Nevis is focused on pursuing a safe economic recovery strategy. Given that the immediate future of the cruise tourism sector is still uncertain, economic recovery efforts will be hinged to developments in the construction, manufacturing, ICT, arts and creative industry, agriculture, and education tourism sectors. The construction sector in particular will be a major economic driver, as well as education tourism, which includes the medical university students. It is worthy to note that this year, the Federation welcomed a team from MSR Media who will be filming some 6 movies there. And one of the main reasons why St. Kitts and Nevis was chosen is because of the low risk of exposure to COVID-19. And as a result, our citizens will benefit from additional employment opportunities with the media group. The government also continues to create an enabling environment for investments and local business startups by providing concessions and additional support to various sectors. The silver lining of this pandemic and the lockdowns was that it gave many of our people the time to hone and develop new skills and diversify their sources of income. And even in a post-COVID context, it will be important to continue in this vein. Just imagine, for example, so far this year, 183 SMEs have been approved in comparison to just 100 last year. This is indicative of people's willingness to not only help themselves, but to also think outside of the box and not be solely dependent on the tourism industry. These new businesses, as well as advancements in the various aforementioned sectors, will be vital to boosting socioeconomic activity in the Federation, and in the long term will be key to diversifying our economy. However, it must be reiterated that if we are to build consumer and investor confidence. And if this strategy is to be successful, then our people must play their part and get vaccinated so that our federation can flourish once again. In conclusion, while St. Kitts and Nevis has managed the pandemic well, the socioeconomic scars will linger for some time. Even as we continue to deal with COVID-19, another hurricane season is lurking on the horizon. As a nation and a region, while we make the necessary preparations in accordance with the COVID-19 guidelines, we can only pray and hope for the best, that our region will be spared from the ravages of any other storms. It would be remiss of me if I did not extend gratitude to our bilateral and international partners for their invaluable support and assistance throughout this crisis, whether it was providing medical personnel or through monetary donations, medical equipment, pharmaceutical and non-pharmaceutical supplies, sharing of knowledge and information, among others. It is imperative that we continue to work together to overcome this difficult period. Likewise, we are grateful to our diaspora here in the US, who have provided tremendous support to our people at home and our students here. The future of our nation, our region, our world will depend on our unified action to fight the scourge. May we be encouraged to do our part so that one day we can all breathe a sigh of relief. And I can welcome you back to following your heart to St. Kitts and Nevis naturally. Thank you.
Thank you so much, Ms. Simmons, for representing Ambassador Thelma Phillips Brown from the beautiful island of St. Kitts and Nevis. We appreciate it. Now we're jumping to the islands of the Pitons, and Ambassador Edmonds from St. Lucia will give us an update on what's happening in St. Lucia. Ambassador Edmonds, welcome. So glad to have you.
Always good to see you, Andrew. I want to thank you and the Authentic Caribbean Foundation, first and foremost, for all of the support that you're providing us as it relates to folks with disabilities in St. Lucia. We very, very much appreciate it, especially at this point in time. You know, I was reflecting on the last time I spoke. I know a colleague of mine spoke in the interim, and it was it was this beautiful story about how well we were doing as it relates to COVID-19. And I think a lot of my colleagues indicated similarly how things were moving along so smoothly. And then all of a sudden, we all faced a second wave, a third wave. I'm not exactly sure right now how to calculate it. But the reality is stark for many of us. In terms of St. Lucia, as it relates to all of the confirmed cases we've had, we're at about 4,297. About 125 active cases. We've had 63 COVID-related deaths. I think at the time we may not have even had one at the point in time when I last spoke. And we right now, when we're looking at our testing regime, we've tested about 36,000 people, and we have about 265 people in quarantine, with about 125 very specifically in isolation. We started to see an increase in early October of last year, and by the end of November, we were seeing double digits increases. Contact tracing basically highlighted that we had just a huge amount of community spread. And basically at the beginning of this year, we had recorded 380 cases. The largest jump was in February. So let's say, to go from a couple of hundred to 4,000, you could see that leap that we basically took within a couple of months period of time, about 4 months period of time. We've had to basically implement some more stringent protocols and of course, heightened surveillance as it relates to the tracking regime. In terms of vaccinations, we've had just about 23,000 people vaccinated with the AstraZeneca vaccine. We got support from the government of India, and that is focused on first responders, key government employees, and the older population. We are waiting COVAX vaccines, which should be on their way to St. Lucia anytime now. So we're hopeful that we're going to be able to double the numbers of people who we would have had vaccinated. Our first set of vaccines were received from the governments of Barbados, Dominica, really, who had gotten their batch from India. So we're very, very grateful. I think one takeaway from this is the solidarity that that has been exemplified by our governments as it relates to sharing vaccines when we got them in our own shores or in our own countries. I know that we have also provided some to the government of Grenada. We never really, once we reopened the economy last year in July or so, we never really closed the country down, but we have changed our protocols. Basically, instead of people having to take show a negative PCR test within a 7-day period of time, now it's basically a 5-day sort of window in which people must do that. Everybody has to go online. We've sort of had to modify our visitor sort of portal. So folks do have to go online and apply to in essence come in. And when I say apply, you have to prove, of course, ahead of time that you have a negative PCR test. You have to basically highlight the fact that you're going to a facility that is COVID approved. So we do have facilities in the island that have certain protocols in place for social distancing and everything else, and that is for visitors to the country. If you're a national and you're going home, you are mandated to go into government quarantine for a period of time. You know, one of the things that I'm not sure I heard my colleagues talk about, but I think all of us have had to adjust our legislation as we've moved through this process. In some instances, putting more and more restrictions on our people and making some adjustments as we've gone along. And it's been an unfortunate reality, but a reality nonetheless, because this has sort of been a moving target in terms of how do we address the spread of COVID-19 and how do we allow people to move, yet try to ensure that they're moving at periods of time and where it's safe, and it does include curfews. I know not everybody's happy. We especially over the Easter weekend, for example, we had some pretty significant curfews in place. But at the end of the day, the effort is really to rein in the spread of COVID-19. We do have some requirements, even as it relates to home quarantining. We have so what's called a bio button, which folks coming home have to put on their chest, which basically monitors one's vitals over a period of time. St. Lucia is, I mean, we're small, but we're relatively large and dispersed in terms of a population. So that really allows us to be able to track people and to see the spikes as it relates to temperatures and otherwise that could be related to COVID-19. We also have a watch that folks do have to put in place as it relates to this mandatory time period. So you go into a facility, and then as you move into home quarantine, you basically have to maintain these tracking mechanisms. You know, one of the things I want to focus a little bit of attention on, at least very specific to St. Lucia, is the economics of this. I mean, we've all, as countries, had to figure out when we open, when we close, how do you manage health and the economy. The reality for us is stark. I mean, we've seen a 50% shortfall in recurrent revenue. We basically are seeing the tax revenue forecasting to decline by 13 to 14% in 21-22. We're basically seeing all of the areas of revenue that we would have, quote unquote, enjoyed are down. Airport taxes have declined by 43%. VAT has declined. Import duties, of course, has declined. So in essence, what you're seeing is the economy contracting very, very significantly. And this has in essence forced the government to go out and borrow more money in order to really and truly direct resources to some of the income support mechanisms that we had in place. As all in all, we're looking at almost about $1 billion EC that we've had to basically roll over or go out and get in terms of new monies to keep the country afloat. You know, in broad strokes, I think the government, when looked at the numbers prior to COVID, and the trending was positive in terms of a country that would have debt to GDP close to 60% or maybe in the 50s, and now all of a sudden looking at debt to GDP somewhere in the 85-86% rate. This is a horrible place for economies in general to be, but this is where we are. Now, I know we're pressed for time, so I just want to close on a couple observations, and I'm very much looking forward to any questions. In as much as the World Bank and others are forecasting an economic uptick by the end of the year, this is still sort of a moving target in terms of COVID-19 and its impact. Vaccines, obviously, and people's willingness to take vaccines and access to vaccines, as has been pointed out by my colleagues, remains a hurdle that we all have to address. But some of the deeper underlying societal issues are areas where I am very concerned about. The test to all of us is going to be, at least immediately, especially in the case of St. Lucia, is policing. And when I say policing, obviously, you've had to spread out and increase policing of a population, in essence, to protect us from ourselves. That means untrained or undertrained people out in the community. And that does at times cause some friction. I'm more concerned with what we're seeing in terms of the impact on education, and the fact that in as much as we have tremendous support from the diaspora and others to put tablets in the hands of our kids, the fact is that this new regime, I mean, I have a 17-year-old daughter here, 16-year-old daughter here who is struggling. When I say struggling, doing fine academically, but probably, well, I know she is struggling in terms of having to be at home and having to work remotely, and it's going to be impactful on a lot of people in our rural communities. Even though we're providing them with the tools, the lack of social interaction is going to be a problem that we're going to have to face for decades, probably. And the other issue that we're seeing is the rise in violence in the home, and particularly against women. And this is an issue that we can't run away from, we can't hide from. So COVID-19, in as much as it's impacted us economically, in as much as the numbers may look good moving forward, the harsh reality is that the societal damage that it is leaving behind is something that we're going to have to deal with for the next 10, 15 years. Thank you for the time, and I look forward to any questions.
As always, we appreciate your presentation, Ambassador Edmonds, and it's great to hear what's happening on the ground in St. Lucia. You're here listening on Facebook Live, and our participants who are here with us on Zoom, Caribbean COVID-19 update and the vaccine from the Caribbean islands have presented. I just want to reconfirm if Ambassador Lauren Gilchrist is here, or representative. Unfortunately, we must move on. On our next COVID update, we'll hear from St. Vincent and the Grenadines. Now it's time for Q&A, questions and answer. Our first question will be from Leonid, who is from Commune for the Deaf, the disability community. Leonid. Leonid?
I don't know if he's still there. I'll just say his question was about the data. Do you have data on deaf vaccinations? And I kind of broadened the question to say, in fact, is the data being disaggregated?
And any one of the ambassadors would like to?
Can you hear me?
Yes,
Hello?
I'm hearing it. Thank you.
Okay. Hi, yes, thank you, Andrew, for allowing me to be involved. I'm just really excited that I'm here. My question, I guess before I do this is Leonid, and the community for the deaf and the support for all deaf accessibility in the Caribbean. For your presentation, it was very interesting. And it's exciting. Before we started, I know that, you know, the deaf community wanted to be involved in the how will we be involved in this information? No one?
Well, if I may, I mean, if the question is, which was the first iteration I got, I mean, we are not tracking we're not tracking. Well, let me rephrase. I'm not sure that we are tracking the deaf community very specifically, at least in the case of St. Lucia. We have identified communities that are at risk. So youth, obviously folks who have medical issues, but I'm not sure, for example, that let's say the deaf society in St. Lucia has been, let's say, targeted as a specific grouping of people, either as it relates to vaccination, as it relates to the prioritization of vaccination, or what are the metrics that go into the prioritization of vaccinations. But the one thing that we are clear on is that the test for us, let me be absolutely honest with you, is the recognition that we may not have, or what we're finding is that a lot of people within the broader community that we don't traditionally, that the underserved community. Now what we're finding out is for example, the clusters of people throughout the country that we may not even have known about who were underserved. That may very well include people from the deaf community. So what we're finding now because of COVID are the gaps that existed in our system as it relates to reaching all of society in terms of providing services. So I dare say that I don't have an answer specific to the deaf community, but I do know that COVID-19 has exposed that our health system and our coverage of the wider community was not as strong as we thought it was. And I think that's a good thing, because I think that basically highlights to us the fact that we have a wide swath of an underserved community throughout our country that we probably had not been providing traditional services to adequately. And now all of a sudden we're realizing where they are and who they are. It probably doesn't answer your specific question, but that's my best effort.
If I may give
Yes,
it.
thank you.
If I may give it just a quick answer, Andrew, like St. Lucia.
Yes, Ambassador.
Like St. Lucia, the Bahamas did not have and does not have a specific program designed for the input of the disabled community, but there's a very organized Council of Disabled Community in the Bahamas, and they have made themselves present along with the Ministry of Social Services, which targets vulnerable communities and family members. family members generally during this pandemic in the Bahamas, and I guess I can say throughout the region, have been very good at looking after vulnerable communities, the downtrodden, those with disabilities, the elderly, and the like. Our family members have taken carriage of that. So for the Bahamas, there's no specific program that targets the disabled, but the disabled have factored themselves in and they have made representation and advocacy. That's the best I can answer to that question.
And if I may add one thing, Andrew, I mean, you yourself know about the work that you've been doing with our National Council. But what it exposed to us in our office, was I didn't even know that we had a National Council for the disabled. And in a sense, what has come out of this, at least on my part and my colleagues' part, is increased awareness of a group that has largely, yes, there's a subvention from government, but to Ambassador Colley's point, there's a tendency that, there's family, and there are also, of course, other NGOs or other support mechanisms that have fed into it. What we have learned, at least what my mission has worked on, and I think you've been witness to this, and I mean, I got to thank you for that, is to properly, fully integrate that entity into, as Ambassador Colley mentioned, a ministerial mechanism. Maybe there was an adversarial relationship that existed between the Ministry of Social Equity and an entity, an NGO that was working on its own. And now what we're recognizing is it has to be an all of society, not an all of government approach, an all of society approach, where public sector, private sector, and the NGO community have to work together a lot more closely to determine what the needs are, and then, and in a sense that democratizes it and it takes it away a little bit, I hate to say it, from the hands of the politicians, and really puts it back where it should be, in the hands of society writ large.
Andrew, if I may just make a submission very quickly.
Yes.
I can tell you that in Barbados, there's a deliberate policy coming out of the COVID unit to interface with the disabled community. As a matter of fact, and not to treat them all as one set of people. We actually had the blind community. We went into their houses. We actually vaccinated them at home. We worked with the Blind Society, and we got them, the disabled community, and we got them out. And also then we had a meeting on the, I believe is around the 12th or the 15th of February with the deaf community. We were able to bring them out and also go to some of them to be able to vaccinate them. But Barbados has a deliberate policy dealing with the disabled community, dealing with these folks through the ministry and through the Prime Minister's office, through the COVID unit. So we've appealed to them, and we've actually gone to them specifically and dealt with them on the issue. And as I said, not lumped everyone together, but being able to go to vaccinate them and having a meeting with the deaf community. Barbados has done that. There is a deliberate policy for that. Thank you.
Thank you all, Ambassador. I want to say ACF, Authentic Caribbean Foundation.
This is Leonard.
All right,
Can
go
I
ahead,
actually
Leonard.
say something else?
Go ahead,
Something
Leonard.
simple. Okay. Thank you for your interest. And it's good to see different perspectives. And I appreciate your time. Now, regarding the deaf community, how like the systems are set up, I completely agree with everyone. But I guess the answer is a bit vague on who's responsible for providing, the test and providing the, what's going on with all of that and with the vaccines. But if we maybe can set up some kind of, not with the government. I mean, I know the government is there, but to provide to everyone or open up. But who, is, yeah, so for the vaccinations, who is, and I mean, I'm happy that some of you have set up some different things with that, but having, like people that are there, I'm just here. I'm happy to help always to catch up and, as being a deaf person, I actually got COVID and I was in the hospital. And so, you know, what people didn't understand is that that if there's a job or if the community people don't know, but I'm happy that that person didn't die. It was not me who got COVID. It was a friend, but it could have been very serious. But I just want to make sure that we're all working together for this one issue. Thank you, Andrew.
Thank you so much. I must say that ACF Authentic Caribbean Foundation is working with the Caribbean community with regards to the disability. And I confirm with Ambassador Edmund and Ambassador Coley. And we look forward to working with many other ambassadors and their island in providing educational support and infrastructure for the disability community. Our next question will be from Rudy Page. Rudy.
Good evening. Thank you, Andrew, and very interesting reports today. The sun is shining here in London, if you believe me. But I'd just like to go back to 2 speakers ago, the representative from St. Kitts and Nevis with regards to COVID, the vaccine and support from the diaspora. So I just wondered whether there was a consensus in the Caribbean, across the Caribbean, to engage with the diaspora here in the UK as it relates to supporting vaccine support in the Caribbean itself. We do have 1 or 2 of the high commissioners having meetings directly. So I just wonder whether there was a consensus, whether that there was a wider consensus for us to really be active, because there are a number of us in the diaspora who are officially involved in what's called vaccine confidence support programs here in London.
Okay, thank you for that question. I personally was not aware of that grouping, but I'm sure we would be able to tap into that source. Are you hearing me?
Yeah.
Yes, I'm sure we'll be able to tap into that source. As I said, that the problem is that in terms of the misinformation and the vaccine hesitancy with our people. So of course, we encourage our diaspora to engage them, to provide the support. And it's not just, you can do so on your own, not just waiting for the high commissions and or embassies to reach out. We want people to do so from their free will as well. In terms of St. Kitts and Nevis High Commission, I am not certain if they are currently engaging the diaspora to that in that aspect, but definitely I will have a word with our office there to see what engagements there are ongoing, and if not, certainly we'll be happy to reach out. Okay. I'm not sure if any of the other ambassadors would like to speak to that.
Well, look, I mean, I hate to speak on an item where my colleague in the UK will probably remind me that I'm stepping out of my territory, but I have to believe that there's a collective effort on 2 fronts. Number 1 is obviously to engage in terms of the authorities as it relates to, of course, access to the vaccine. But number 2 is the communication with the diaspora. I have this WhatsApp group that is part of the guys who I went to high school with in St. Lucia. And I'll tell you, I mean, I'll use the word the information. I don't want to call it misinformation or whatever it is, but the information that is shared with that group blows my mind in terms of how sharp and exposed most of these folks are. So there's clearly a need for us to use every single means at our disposal to share information factual information with the diaspora, because as you can, the different plots and the subplots that are being shared have gotten a life of their own, and there is this need. Now, I can't lie to you, on a local level, it's taken us time as governments to basically roll out initiatives on the ground to educate our population. So, and through Facebook, you see, prominent people in our societies really getting the jab and all of this kind of stuff as a way. So we as representatives of our governments spend a lot of time focused at home and really and truly trying to get it right, and we're still struggling. But I dare say that you're onto something. I mean, I'm sure there's work being done, but it probably is not as coordinated as it should be, because the amount of information that's out there and the way that it is being spread, WhatsApp, Facebook, and other mechanisms, it becomes a daunting task for our offices to get into all of those spaces. And as you well know, and you can imagine, the diaspora communities are so spread. Even within a country like St. Lucia, you have different groupings in the UK or elsewhere. So it's still a work in progress. And for the most part, I must admit, it is being done a little bit piecemeal. We're all sort of trying to do the best that we can to share the science, but we do need to do a better job, even maybe here in the United States, as it relates to pulling the data together and getting the facts out regularly into the space.
Well, we can certainly assist on that. I mean, there is already a precedence in the region for working from a diaspora perspective through into the health systems in the region. If you take the 4 mobile blood collection units from which I help facilitate, Antigua and Barbuda, Grenada, Jamaica, and St. Lucia health systems. So it's not that difficult, and we have enough members of the diaspora. I'm talking about the English-speaking Caribbean diaspora now, here in the UK, who are working in health and social care at different levels. So a consensus is not going to be difficult to put together if there, as I say, if there's a collective action is not going to be difficult to put together if there's a consensus through the high commissions and just generally from the Caribbean, a message that says, yes, we would like to see the diaspora who are focused on vaccine confidence support programs within the NHS and social care system, then they would respond to that.
May I just briefly, Andrew?
Yes, Ambassador.
Thank you, Mr. Page. It's actually good to hear from you. Good to hear a voice from the other side of the pond in the diaspora, because the impression many of us were getting was that Europe was hit so hard, and many of the variants developed in Europe, including the United Kingdom, that generally the nations and the peoples of Europe had their own struggles and were dealing with the virus, perhaps with a heavier load than us here in the Americas. We have been in touch with the Bahamas missions in Geneva, in Brussels, and in London. And basically what the consensus is that the diplomatic corps is not as organized around this issue. That's the information that came to us as we are here across the pond. But the governments that have satellite countries or colonies, for example, the Turks and Caicos Island and the Cayman Island, and I believe 1 or 2 of the islands in the Eastern Caribbean, they have come forward and rendered great assistance. As a matter of fact, when the rest of the Caribbean was still crying out for equity in the distribution and access, many of the islands were already getting vaccinated. And I imagine that the Turks and Caicos Island and Cayman Island could be close to herd immunity because they had gotten the jump on us. But I'm just very happy to see you reach out. And maybe this is the beginning of a collaboration with the diaspora in Europe and the diaspora in the Caribbean. I mean, it is very easy for you, Mr. Page, and others to contact us at our different missions. And I don't see any impediment to having a line of communication and having some structure in place where the diaspora in a more formalized way in the Americas and in Europe can collaborate. So I think this is a good thing.
Okay, thank you.
Thank you so much. Due to timing, limited time we have, we're going to wrap up with what the future holds for 2021 and beyond with Dr. Claire Nelson, who will lead us off into that discussion.
Thank you very much. Thank you so much. We won't have a much discussion. I would like to just mention some things that came up. A lot of what I heard is that we're talking about advocacy and justice and equity. And the first instance, I think advocacy certainly both here in the US, I'm sure Canada, and to some extent the UK and Europe, diasporas that are organized to do this are open to do that. But I have to ask that the ambassador send a strong signal to CARPA, the Caribbean Public Health Administration, that the diaspora is a part of the network and a part of the solution. Most diaspora organizations, as you know, are self-financed, as in they don't have any funding. And so while we're happy to, beat the bushes, we do need to have that body to which we can say, we need the data that looks like this, we need reports that looks like this, and a place to go to find that. We understand, certainly for embassies that are very small and very understaffed, there's so many other things beyond COVID that you're doing, number one, and so many things beyond COVID in healthcare alone that you're doing. And so I think it would be very useful if, as a collective, the Caribbean Caucus of Ambassadors send a strong message to the Caribbean Public Health Agency that they should be charged with creating a place on their website and also maybe a one-person focal point to which we can go for data that they gather from all the countries, and we go there and find it and then download it. They need to have the resources available that we can just use and send out to, whether we're advocating at the state level, the local level, or the federal level. That's critical and important. Beyond that, I want to add that some of the issues that has been exposed in health education have been addressed in the documents that we are preparing now to share with State Department as we look towards our plans for the health working group and the Health Futures Forum we're doing in June, as well as the Health Legislative Roundtable. So people who want to participate at that level of real action, not just listening, but real talk, we invite you to join that. But more importantly, again, for years I've been asking for there to be a specific arrangement for diaspora healthcare diplomacy or diaspora healthcare investment to be structured so that countries use it most effectively and efficiently. And so I think it's a good opportunity not to go back to what was where everybody's fending for themselves, trying to figure out how to get things on the ground, etc. There needs to be a situation where CARPA works with the ministries to create, number one, an institutional arrangement so that a Jamaican who may want to do a medical mission in St. Lucia, for example, can easily do that without having to do the same thing 3 times if they've been doing it in one island. So when I say systematize, we have to be more efficient and effective. And the message has to go strongly that post-COVID, we cannot return to the old normal. We're talking about a post-normal or a new normal in terms of healthcare. So we move towards equity and justice in access across all, healthcare for all. And those are just 2 things. So I think that this year, as we move towards June, those people on this call who want to support the healthcare agenda, please send an email so we can plug you in with the team. I think we have one member of our team was on this call, Miss Paul. I'm not sure if she's still around, but she was on this call earlier. Secondly, to ask that there be a conversation be structured with CARPA to make sure that we are moving forward to have the data so we can be better advocates. And thirdly, beyond that, I heard what you said about economic recovery. That'll be a major piece of what we're talking about in June as well. So I do hope that we can get support to have a stronger civil society partnership on the ground, with civil society on the ground and us here, because again, the embassies, as you heard one of the ambassadors says, cannot be the end all of what we're doing. But civil society in the region is weak. So again, can CARICOM use this opportunity of COVID to put in place a stronger structure so that come CARICOM heads of government, the diaspora has its own space as part of Caribbean civil society. I've been asking for this for over 15 years and I've not heard anything. I want to again raise this issue. We will want to ensure that on the day when civil society is allowed to speak to the CARICOM heads of government, there's room for the diaspora organizations to participate and have our own slot. And with that, I pause and I turn the floor back to Andrew Sharp. Thank you.
Thank you, Dr. Nelson. And I do advocate the importance of the Caribbean diaspora, especially in the United States, in terms of advocacy, seeing how we can advocate with our Congress and the White House in terms of access to vaccine for the Caribbean community. My viewpoint, and I was not happy to see that US gave Canada and Mexico, but the Caribbean was left out. So the Caribbean diaspora can advocate strongly to ensure that the Caribbean is not excluded when discussion pertaining to assistance, especially in this case of vaccine, COVID-19 vaccine. We're so happy that you guys and all the ambassadors, representative, friends of the Caribbean has joined us for another COVID-19 update. We're so happy and we want to thank the ambassador for coming forward to engage with us right across the diaspora. Thanks for across the pond, as what Ambassador Edmund says. Rudy, we're so happy to see the UK with us, the diaspora, and we look forward for action plans, improve our healthcare system, and provide educational support for both our Caribbean American community here in the US and in the other diaspora region, and also to provide educational support to the Caribbean itself. Thank you once again. We appreciate you joining us to get an update as we continue to engage with the Caribbean diaspora and its diplomatic ambassadors who are based here in Washington. We appreciate you providing us with an update and looking forward to our continued support, especially for those persons with disabilities. Thank you once again for joining us. Thanks to Dr. Nelson, thanks to all participants, and thanks to Facebook listeners. This was quite an update, and we appreciate everyone who have joined us on this COVID-19 update and the vaccine. Thanks again.
Goodbye, everyone.
Have a good night.
Thank you.
Walk good.
Thank you.
Thank you. Thank you. Thank you. Thanks again. Thank you for your time. Thank you.
Thank you.